We're going to turn now to a GMA health alert on whooping cough. Thanksgiving's right around the corner and cases are on the rise across the country. Texas is currently reporting they're seeing 4 times the number of cases this year compared to last. And Dr. Leah Croll joins us now with more. Dr. Croll, thank you for joining us here at the desk. Can you break down what we are seeing here?
Absolutely. So whooping cough is also known as pertussis, and it's a highly contagious bacterial infection that causes respiratory illness. We're seeing a spike right now. As you said, Texas counting 3,500 cases so far this year. That's 4 times what they were seeing last year. The CDC saying we have 21,000 cases nationally, and there's probably a couple of factors behind this. First of all, we have lower rates of vaccination against whooping cough. Before the pandemic, 95% of kindergartners were vaccinated going into school. Now it's only 92%. That's a meaningful difference. And with adults, you need a booster every 10 years to maintain your immunity, but only 39% of American adults are keeping up with those Tdap boosters. So it's that combination of waning vaccine immunity and highly contagious bacteria that's driving these high numbers.
A difficult confluence there. So what signs or symptoms of whooping cough should people be looking out for, and what can they do about it?
So, Will, here's where it gets a little tricky, because at first whooping cough looks just like your common cold. You may have a mild cough, runny nose, fever, but as it progresses with time, you develop these more intense, prolonged coughing fits that can go on for weeks to months and can be so intense that they actually cause vomiting or a high-pitched whooping sound as people gasp for air between coughs. So this can get serious, and important to know that babies are the highest risk for severe disease. They can even have something called apnea, where they stop breathing when they're very sick with this. So if you suspect that you or your child has whooping cough, important to go get checked out immediately, get tested. Antibiotic treatment is very effective and minimizes the risk for those more serious complications. And of course, the best protection against getting sick in the first place is vaccination. We have decades and decades of data to back up the safety and efficacy of the whooping cough vaccine. Babies should get a series with the pediatrician. Teens get a booster. You get a booster with each pregnancy, and adults are eligible for a booster every 10 years.
That booster sounds very helpful. Dr. Leah Croll, you are helpful as well. Thank you so much for keeping us smarter on that. We appreciate you.
Yeah, good information for parents there. Thank you so much, Doctor.